Hello guys, and welcome to Showtime Live. This is My Health is My Wealth with me, This is a show that comes to you every Tuesday evening, and this is a show that's supposed to teach you about your health. Remember that they say that an apple a day keeps the doctor away, and this is just a bite of your apple just to help you keep the doctor away. So today we are going to talk about cancer. I did my research with my doctor. I was with my doctor the other day, and I asked him a few questions about cancer. He was not able to join us today, but we're hoping that the next episode is going to join us. But trust me guys, I have enough information for you which is going to help you out there. Remember that I'm not a certified doctor, but I hope that the information that I'm going to give you today is going to be of help. So today we are going to learn about cancer. Now, cancer has become a major crisis in today's world. I mean, it's becoming a global crisis. It has drained people's finances, people's health, people's livelihoods. So today, let's learn about cancer. What is cancer? Now, normally your cells multiply in a normal kind of way. So, if for example, it's supposed to multiply like 10,000 cells per day, that is probably normal. But now, when cancer comes in, it's when now the cells now start multiplying abnormally. If it's supposed to multiply like 10,000 cells, it multiplies to up to probably like 500,000 cells very fast. So now when it multiplies like that, it forms something called a tumor. So when a tumor comes in, if for example you have cancer of the breast, and there's cancer there, it means that the cells are going to multiply very fast. That's going to cause something like a hard thing called a loop. A tumor that blocks the oxygen and the nutrients to get to that specific organ, and that causes withering. So now, because we have understood what cancer is all about, let us look at cervical cancer. Now, cervical cancer is one of the major, the common types of cancers that are found in women, mostly between the age of above the age of 21. So we need to understand what cancer is all about. Now, the cervix is a part of the female genitals. That is, it's an opening of the lower uterus that goes to the birth canal. And there are two types of cells that are there. And there's a place called the transformation zone. And cervical cancer normally affects the multiplying of cells, comes there in the transformation zone. But before we go there, let us find out the major cause of cervical cancer. It is caused at some point in your life. It is very common, and depending on your body immunity, HPV normally clears itself. HPV has so many strains. It has many strains, like between 1 to 100 strains. But now some of these strains will clear off, but some of these strains of HPV can lead to cervical cancer. And these strains include HPV 16 and HPV 18. Those are the common types of HPVs that lead to cervical cancer. Let us look at HPV and find out how is it transmitted. It is transmitted sexually, and sometimes the level of HPV can be accelerated by various factors. For example, number one, we can have smoking. Smoking is one common thing that can accelerate the level of HPV. Number two, it can also be depending on your immunity. Always make sure that your immunity is good. Eat foods that are rich in vitamin C to ensure that your immunity is good. And also STDs can also accelerate the rate in which HPV can work. It can cause damage in your body. So let us practice. Something else I need to mention about cervical cancer. Other people who are at higher risk of getting cervical cancer are those people with probably many children. The more children you get, the more higher risk you have of cervical cancer. But it does not necessarily mean that you're going to have cervical cancer if you have many children. But women who have many children have a potential of getting cervical cancer. And also people who normally use birth control pills, prolonged use of birth control pills. Now, I am not against contraception, But it's good that every time you take a contraception as a woman, it is good that you consult with your doctor. If the hormonal ones are not working for you, go for the non-hormonal ones, because there are so many varieties of contraceptives, and it is good that you talk to your doctor before then. Now, let us talk about cervical cancer. Now, there are tests that are normally done on women. A pap smear is when the doctor will examine your cervix. Normally you go to the hospital. I don't know if I should I don't know if I should, but let me explain how it goes. When you go for a pap smear, and in Kenya a pap smear is free in public hospitals, where the doctor will examine your cervix. Most women will say that, oh my god, this procedure is very uncomfortable. Yeah, it is really uncomfortable, but it is very, very necessary, because the doctor normally scrapes off some cells at the cervix, and they get a sample of those cells to find out if they are precancerous. What I mean by precancerous is that these cells could lead to cancer in future. So when a woman goes through a pap smear, the doctor normally scrapes off some cells, and then they are taken to the lab and they are tested to cancer. If, for example, the doctor finds that there are no cervical cancer, potential cancerous cells, well, you are told maybe you come back after 3 years, because a pap smear is supposed to be done after every 3 years. But if there are cells that are there that can lead to cancer, it now requires you to undergo another procedure called a biopsy of those precancerous cells, and they take them to the lab again to test whether they can be precancerous in future. Now, what normally happens in a pap smear is that the doctor will, as I've said before, the doctor will scrap off the cells, and they are going to test whether they are precancerous. So we have different types of cancers, of tests that are going to be These cells that normally cause cancer can be taken, and they're taken to the lab. That's called a biopsy. So what happens with a biopsy is that now, if the cells are really precancerous, the person is required a procedure called a loop extraction procedure that involves the removal of these precancerous cells. So what normally happens in this case is that the patient is taken to the hospital, and they're normally put on a bed, and the doctor is going to examine that place, and they are going to burn the cells that could potentially lead to cancer. Now, it does not mean that these cancerous cells are going to turn to cancer the next day. It means that with time, probably within a period of 10 years, these cells will continue going deeper and deeper into your cervix, and then they might get to your uterus. So if you detect these cells earlier enough, it could help you prevent cancer. That is why it is very important as a woman to go for a pap smear, as much as it seems uncomfortable. Now, if you listen to people and they'll be like, oh, don't go for this pap smear, oh my god, they are very painful. No, they're not. They are uncomfortable, as I've said before, but it is important as a woman, considering that we are living in different types of today's world, where we are using contraceptives, we have different diets, and it's very important that we take care of our health. So women out there, please make sure you visit hospitals, public hospitals, private hospitals. They all have pap smears, and it's not like a process that you'll be doing every day. It's once per every 3 years or 2 years. So it's not something that you'll be doing regularly. It's just making sure that you that removes the precancerous cells. Now, if, for example, you go later, maybe you start experiencing, now some of the symptoms that you might experience when you have precancerous cells are abnormal discharges, mostly a brownish discharge that is normally smelly, especially after your period. If you have a smelly discharge that is not really normal, your normal discharge, that during ovulation you have this type of discharge, after your menstruation period you have this type of discharge, but there's that bad, that abnormal discharge that you might get, and sometimes can make you feel uncomfortable. And these cells, but it does not mean that you have that, because there are other diseases that could also lead to such, but it is important that you see a doctor. And then sometimes you might feel a little bit fatigued, and these are some of the symptoms that you should watch out for as a woman, especially if you are sexually active. It is very, very important that you watch out for these symptoms. So what happens is that when these precancerous cells, for example, a patient has realized these symptoms much later, so sometimes you find that these precancerous cells could have gone deeper, like if they're not on the surface of the cervix, they could have gone deeper and they could have reached the uterus. So sometimes the doctor will say that this probably cannot be treated just by, burning out the cells. Some women are told to remove their uterus. Yeah, so because this could lead to cancer, because we have the uterus, then we have the cervix. If the uterus is already infected, the who probably don't want to have children already have children. And I don't want to say that it is these problems might start coming when you are older. People will say that these problems might come when you are older, or when you are like 30, 35 and above. You should already have a child. You can get a child any time of your life, as long as you are keeping yourself healthy and you're checking out as a woman. But sometimes the removal of the uterus, if the precancerous cells have really gone deeper, is prescribed by the doctor. And well, if you don't want to have children by then you can have your uterus removed. So before it gets preventable, and maybe somebody who is above the age of 10 might not get the vaccination, but people out there, if you have children, if you have girl children who are below the age of 10, there is a vaccination for HPV. So make sure if you have a girl who is between the age of 1 to like maybe 10 years, make sure that they get their HPV immunization, so that they are able to prevent themselves from getting HPV, because it is one of the major leading causes of cervical cancer. Okay, something else that I need to mention about this kind of treatment where you have your precancerous cells removed is that 95% of patients who undergo this procedure heal completely. So it doesn't mean that when you undergo this treatment, you undergo this treatment after some period of time. It means that if you undergo this procedure early enough, it could mean that you are free from getting cancer. But sometimes you do have these precancerous cells recurring, so it is important that you still continue with your pap smear just in case they recur. So if you have these symptoms, as I mentioned before, if you have pain during sex or after sex, if you have abnormal discharge, it is very, very important that you watch out. You go for your pap smear. At least if you are above the age of 21, after every 3 years, make sure you go. If you are above the age of 30, at least after every 2 years, go for your pap smear. At PGH, it is very free. The doctors are very friendly there. If you go to Outspan Hospital, probably if you're using your insurance or whatever, so long as you go to the doctor and have your pap smear as a woman, please let these words spread that it is very important for the current woman to have their pap smear. And I keep on mentioning it is, please go get your pap smear today. It is very, very important that we prevent cervical cancer. Okay, so as I've said, that when you get your treatment, it normally goes away. 95% of patients have reported to say that you have reported and have said that their problems have the problem of the symptoms that they were having have gone. So 95% of the people actually get full treatment after getting their precancerous cells removed. Now that you have understood what cancer is, as a woman, please make sure that you have gone for your treatment. Go live a good life. If that also cancer is also genetic. It doesn't necessarily mean that if you get cervical cancer, you have HPV. But the most common type of cause of cervical cancer is HPV. And I've said that if you have a girl child who's below the age of 10, please make sure that you have taken them for immunization for their HPV, so that they don't get these virus that could potentially lead to cervical cancer. Well, if you have any questions about cancer or any other type of disease that you want us to talk about, hopefully the next episode we are going to have our doctor coming in. But I hope that information that I have given today is going to be of much help. Let us fight cancer, because if it is predicted, if it is detected, so if it's detected early enough, it is very, very treatable. So let us not just be ignorant. Let us visit some of these checkups for our well-being. So thank you so much for joining us for this episode. It is yeah.
God.
So thank you so much for joining us for this episode with me, Washendage Konyo. Remember, I have mentioned earlier that I am not a certified doctor, but I talked with my doctor, Dr. Christine from the Outspan Hospital. When you visit there, you're going to meet Dr. Christine from the Outspan Hospital, who is a very good gynecologist, who gave me all this information, and I'm so happy to share it with the world, and I hope it's going to be of much help. Even the men out there, let us support our women. And also, I've not mentioned that men are also the ones who, of course, when you have sex with a man, he is the carrier for HPV. So make sure that even as a man there, you have you have practiced safe sex out there, so that we keep our loved ones safe. It is very, very important. It is not just about HIV, gonorrhea, syphilis. Let us just put cervical cancer as a sexually transmitted disease. In quotes, it's a sexually transmitted disease because the major cause of cervical cancer is HPV. So let us practice safe sex, or just abstain. Or just abstain, guys, because cancer is a deadly disease. And if you are there and you're suffering from this disease, I hope that it all goes for you. Remember that there are treatments for cervical cancer. It is actually treatable, because you can go for chemotherapy, you can go for radiation, and I wish you all the best. And for those people out there who are watching this program, make sure that you have spread the news, you have shared this video, subscribe for more and more health matters. And remember that your health is your wealth. You might be having way too much wealth, but you don't have wealth, and it makes your life, it could make your life miserable. So it is very important that you practice good health. And thank you so much for joining me, your host, Washendage Konyo. I've been your doctor for today, and let us stay healthy, and I'll see you on the next episode of My Health is My Wealth, live at Showtime Cinema every Tuesday. Thank you so much. Don't forget to subscribe.